Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today is Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Vaccines are the most effective way to prevent the spread of infectious disease, but developing one can be costly, long, and complex. However, with significant investment and collaboration at a global scale, developing a vaccine is possible in a much shorter period of time. So how are vaccines developed today? And will the development of a COVID-19 vaccine be different? All vaccines go through three basic stages of development: the exploratory stage, the preclinical stage, and the clinical stage. In the exploratory stage, scientists do basic laboratory research to find vaccines that can help us develop immunity to a disease before being exposed to it. On January 11, 2020, the genetic code of the virus causing COVID-19 was published. This allowed scientists all over the world to start working on finding potential vaccines. With more than 150 in development worldwide, scientists are using current approaches like using whole or parts of killed or weakened virus, and newer techniques such as delivering COVID genetic material directly into cells. In the preclinical stage, scientists use laboratory and animal studies to identify safety concerns before testing the vaccine in humans. It is also used to help find the safest dose. While many vaccine candidates don't progress beyond this point, successful ones move on to the clinical stage, where they are first tested in humans. This stage normally consists of three phases. Phase 1 trials involve a small number of healthy volunteers to test safety and confirm that the vaccine causes an immune response. An immune response refers to how our bodies recognizes and defends itself from viruses and other potentially harmful substances. Promising vaccines then progress to Phase 2, where they're given to hundreds of participants, including groups at risk of the disease. The goal of Phase 2 is to test the vaccine's safety, the proposed doses and method of delivery, and again, to assess the immune response. Phase 3 studies involve thousands of volunteer participants and compare groups that received the vaccine to those that didn't. These studies are used to further answer whether the vaccine works and still demonstrate that it's safe for use. One way scientists have worked to reduce the time to develop a COVID vaccine has been to use study designs that allow merging of clinical phases. For example, new approaches have allowed for Phase 2 participants to be included in larger Phase 3 studies, allowing scientists to shorten the overall timeline and number of participants needed, without cutting corners or compromising safety. The first COVID-19 vaccine trials in humans started in March of 2020. Since then, tens of thousands of volunteers have been enrolled in clinical studies worldwide. Health Canada, responsible for regulating the use of vaccines in Canada, has authorized clinical trials for COVID-19 vaccines. Before approving a new vaccine, they look closely at all the data on it, paying very close attention to its safety. Many vaccines will fail somewhere along this path if they don't work or are unsafe. It's normal, and this is the purpose of all the stages of development and clinical trials. Only those that are proven safe, effective, and of high quality will be approved for use in Canada. A safe and effective vaccine will bring us one step closer to the widespread and long-term management of COVID-19. When a vaccine is ready, Canada will be ready too. Visit canada.ca/coronavirus to learn more.
Good afternoon, everyone. Thanks for joining us today. We'll start with an update. Since the media advisory yesterday, we have 2 new cases of COVID-19 in our province. Both are male in the Western Health Region, one between the ages of 50 and 59, and one between the ages of 60 and 69. Both are related to travel. The total number of cases in our province is 410, and there's been 1 new recovery since yesterday, leaving 14 active cases in the province. In total, we have tested 81,060 people. We are asking passengers who traveled on the flights that listed below to arrange COVID-19 testing. So you can call 811 or do the online assessment. Air Canada flight 7480 from Montreal to St. John's on Friday, January 22nd. or Air Canada Flight 7481 from St. John's to Montreal on Sunday, January 24th. Public Health is making this ask out of an abundance of caution and because they are aware of a confirmed case of COVID-19 in a traveller with the possibility of potential exposure on these flights to and from the province. Contact tracing is finished for the case and the individual is no longer in the province. This case is not related to any confirmed cases in Newfoundland and Labrador at this time. To date, the cluster identified in Eastern Health Region last week has not grown beyond the 5 cases. We have not yet identified a source, however, the investigation is ongoing. As a result of contact tracing and notification of potential exposures in several establishments, over 200 individuals have been tested for COVID-19. While all tested have been negative to date, individuals who have been exposed to a case will still need to self-isolate for 14 days in case they become symptomatic. And as I indicated last week, a negative test is not a guarantee, and if the swab was done early in the incubation period, it may result in a false negative. These samples have been sent for whole genome sequencing to determine if any are the result of a COVID variant. Provinces across Canada, including some in Atlantic Canada, are reporting COVID-19 variants of concern. Variants of COVID-19 arise from mutations in the genetic code of the virus, and many mutations such as this have happened to date, and not all of them give rise to variants of concern. The mutations that have arisen in these variants are concerning because they allow the virus to spread from person to person much easier and faster than the original strain. We have seen in other countries that when these variants start to spread in a community, they quickly become the predominant strain. Our goal, therefore, has to be to keep this contained as much as possible. We will almost certainly see cases of this new variant in this province. We will not be able to stop it from coming if it is circulating elsewhere in the country and the world. The key will be to stop its spread beyond that initial case. Control of these variants of concern is being discussed at federal, provincial, and territorial tables, and the federal government has recently implemented new border strategies in this regard. We continue to follow the evidence and best practice in our response to these variants of concern. And we are also developing the technology of whole genome sequencing here at the Provincial Public Health Laboratory so that we can identify these variants more quickly. As I've said many times, we all need to carry on as though COVID is in our midst. The families who were impacted by COVID last week were no doubt shocked to get that phone call from Public Health. This could happen to anyone at any time. So remember, we all have it in our power to reduce the spread of COVID, whether a variant or not, by using your tried and true public health measures and by following the rules for travel and quarantine. As we approach Super Bowl weekend, please remember to keep gatherings to your close, consistent contacts. Our special measures orders set a maximum of 20 people for an informal gathering, but I encourage you to think long and hard before you organize or attend a party of that size. Consider if these are the people you already interact with in close proximity on a regular basis. Consider if you have the space for individuals to distance at least 6 feet from each other. Remember not to serve shared bowls of chips, dips, or trays of food. And do not host or attend a gathering if you have any symptoms, even if mild, even if you think it's just a cold. It may not be so. You should stay home until 24 hours after your symptoms have passed. Ask anyone attending a gathering to download the COVID Alert app so that they can be notified if they have been exposed to COVID. When it comes to gatherings, everyone needs to be mindful of the potential risks and consequences for themselves and their family. And aside from the most significant risk of the virus itself, there is the possibility that you may unknowingly spread COVID to your friends and family. There is also the risk of being identified as a contact of a positive case and required to quarantine, potentially impacting your income. We need everyone to stay vigilant. Variants of concern continue to spread, and we find ourselves in a period where the supply of vaccine has dropped. While we had anticipated that there would be temporary delay in the delivery of Pfizer vaccine, we have also been informed that we will also see delays in the delivery of the Moderna vaccine. The province has not received new vaccines since our last briefing, but we are expecting a limited shipment this week. All health authorities are working diligently to vaccinate those in the Phase 1 priority groups. As a recap for those who may have just joined us, we have 2 new cases since yesterday's media advisory. The total number of cases in the province is now 410. As we move into the 11th month of this pandemic, we need to remain optimistic for the future and for our potential to keep COVID contained. We have been doing so well for so long, and I know that we have the ability to see us through this together. Hold fast, Newfoundland and Labrador. Thank you. Now I'll turn it over to you, Leslie, for questions.
Thank you, Dr. Fitzgerald. There are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, the fact that the cluster in the St. John's area is still sitting at 5 cases, you had said you were concerned that this might be evidence of widespread community transmission because you can't find the source. What does it tell you that you haven't been finding new cases in the last few days?
So certainly, it's reassuring that we're not finding new cases, but it doesn't mean that there won't be cases that pop up. Certainly from a forward contact tracing point of view, we feel like we do have all those contacts identified and they've been tested and they're in isolation. So that's a good thing. So, but what we're worried about most is sort of that backwards contact tracing and where people may have potentially been exposed. However, we've done extensive testing of contacts as well as testing in 3 establishments, staff and patrons. And so to date, we haven't found any of those cases. So it may mean that the source was not infectious for long or is no longer here, and there wasn't a lot of potential exposures. But, we're still, we still don't feel we're out of the woods just yet. We can put a little bit more time between us and this cluster. I think we'll feel a bit more comfortable.
I want to ask about rotational workers. New Brunswick has just tightened their rules and are requiring a full 14 days of isolation away from family, or the whole family has to isolate. Considering many of those workers are coming from some of the same places that our rotational workers are we considering similar measures?
So we haven't had that discussion at this time. We're always looking at the latest evidence just to make sure that we're staying current with what's happening with regard to epidemiology, and so those are conversations that we will be having, I'm sure, in the next few days as to how we respond to some of these variants of concern, for example.
Thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I'm wondering how you feel about the use of schools as polling stations. I know this has been brought up before, but given that boards have been reluctant to even allow families in for student activities, what's your epidemiological view on that?
So the, public health didn't make the recommendations not to have to have weekend events in the schools or anything like that. I think that was more of an operational decision with regard to cleaning and things like that. So if you have a polling station set up and it is done safely and cleaning can happen afterwards, then that is a safe way to do things, and I don't really see any major concerns with that from a public health point of view.
Okay, thank you. And actually a follow-up on cleaning. One of the restaurants that was the site of a possible exposure here in St. John's, they're talking about how they went through a deep sanitizing process before reopening yesterday. Is anything other than a routine clean necessary for such businesses?
So there are cleaning instructions and advice guidelines available on the website, so certainly we do recommend those. We just recommend, a Health Canada approved cleaner, and to make sure that you cover all of those surfaces where people frequently touch, doorknobs, rails, tabletops, chairs, those sorts of things. So I don't know specifically what companies refer to when they're talking about a deep cleaning, but certainly as long as those surfaces that the public would come into contact with are well cleaned, then that's sufficient.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, I'm curious, how many people are currently self-isolating because of the cluster? At last count, I think on Friday it was 160, and you mentioned 200 people had been tested. So I'm wondering how many people are still going to have to self-isolate as of this moment.
Certainly there's over 200 people who had been identified and needed to self-isolate at least until their test came back. Those are involved in that forward contact tracing who have been potentially exposed to a case have to isolate for 14 days. But if the person is further back and further removed from the case and we're looking for source exposure, then that isolation isn't generally as long as the 14 days. But so on the whole, over the course of the investigation, over 200 people have had to isolate or quarantine. But I don't have the exact number who are in quarantine at the moment.
Thank you. And earlier you mentioned, COVID tests are being sent now away to the National Microbiology Lab for variant testing, and you're trying to get, and the process is on the move to get the local lab to get that capability. So I'm curious, can you walk us through how that process works? Because previously, to just do the COVID testing, it was just local lab had to match the Winnipeg lab results.
Yes, so the whole genome sequencing is a little bit different, and so what happens is they have somebody who is able to do that testing here, somebody who has that expertise who's able to do that, and so as long as they have the equipment to be able to do it, then they just have to get that equipment up and running and the process and the protocols done, and to get all of that in place. My understanding is that we've had lots of samples that have gone off to the lab for whole genome sequencing. So if we can actually retest those here and compare to the ones that have been tested by the National Microbiology Lab. So there's some internal validation that can happen there as well. So, so hopefully the process will be up and running soon here.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Dr. Fitzgerald. You mentioned that the province will be getting a limited shipment of vaccine later this week. You know exactly how much of the vaccine we'll be getting and what areas of the province will be getting it?
So I think it's one tray of Pfizer that will be coming in this week. And I'm not, I certainly wouldn't want to misspeak, so I'm not 100% sure where it's going at this time.
Okay, and when we had the Grand Bank cluster, the testing went pretty deep and went on for a couple of weeks. This cluster is in a much bigger and more populated area, so how deep does public health go into finding the source of this before we deem it community spread?
So with the Grand Bank cluster, you had to remember we kept getting cases over time, and so then you had to do contact tracing with those cases, and so that's why that went on a little bit longer. So beyond those initial 5 cases that we had, that we haven't seen any more. So that forward contact tracing doesn't have to continue, and then the backward contact tracing gets done, with those 5 cases. So we don't have to. If you don't have more cases, then you don't have as much of that to do. So, if we start to see more cases as a result of this, then this will go on a little bit longer as well.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, last week you'd noted that we had put enough vaccine away so that people could get their second dose. Just wondering if that's still the case right now and that many people won't have to go back to square one.
Oh, no, we have held back enough for second doses of the people who've already had their first.
And are you concerned of how many people were determined to have been potential contacts or potential exposure to the recent cluster? I think you noted more than 200 people tested. Does that raise some alarms for you?
So it is concerning, absolutely. You know, if we're talking about trying to keep your contacts low, then it's, you know, it's a lot of work to do. So it was a lot of work for public health and Eastern Health to, and a lot of time for all those phone calls that had to happen and all that follow-up that had to happen, that testing that had to be arranged. But if any of those contacts had tested positive, then that had to happen with all of those, you know. So it could get out of control quite quickly. You know, so far we've been fortunate that we haven't seen any more cases, but if we had seen more cases in those contacts, then, you know, that would put that would be a lot of work for public health. And, you know, at a time when we're trying to get vaccinations done as well, there's the more contacts you have, the harder it is to do, or the more it takes to do the long contact tracing.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
It's been we're just a couple of days shy of a month from when the decision was made to extend the closure of the Atlantic bubble for 1 month. With the election campaign underway, is that decision going to be reviewed by yourself, or is this going to be something that is going to be held off until the election period is over?
Yeah, so those decisions are not just mine to make. You know, they are conversations that happen on a lot of levels. So I think we'll certainly be waiting until that the election period is over.
And we've heard complaints from people who have encountered, in particular men, in stores and public places who refuse to wear masks, not because of medical reasons, just because they don't want to. I know they've shared their thoughts with you as well. Since individuals in stores aren't supposed to be enforcing the mask wearing, how do we address the issue of people who have just decided they don't want to?
Well, I mean, the expectation is that you will wear a mask if you don't have a medical contraindication to it, and certainly there are very few of those medical contraindications to a mask. There is, you know, it is under a special measures order that you have to wear a mask. So if at some point you are found not to be wearing it by enforcement, it can be enforced. And so, you know, that's another reason why you should definitely follow that special measures order and wear your mask. You know, it's not just about it's not just about protecting others anymore. We know that wearing a non-medical mask, especially if you have one that's 3 layers, although 2 is still okay. You know, that you can have some protection for yourself as well. And I think as we look at variants of concern that are circulating, it certainly really, you know, it behooves all of us really to follow that special measures order. It's just a piece of fabric. It's, you know, it's not particularly onerous, I don't think, for people to be able to comply with it. Most people.
Thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, I wanted to return to the Eastern Health Cluster again. Is it unusual that this case involving the daycare has remained a suspect case for so long, even though ICU testing was negative?
As I said before, suspect cases are those that are symptomatic but test negative. And so I can't really release the details of, symptomatic, test negative, and have had contact with a confirmed case. Sorry, that's a big important thing to put in there. And so I can't really comment on the specifics of one person's testing or medical history at all, but so it just depends on the what the results of those tests are. So if those tests remain negative, they still can be a suspect case. You know, we do know that some people can have several tests done and be negative and then suddenly test positive. So we wouldn't necessarily test somebody until they became positive in that situation, if their symptoms resolved, we would treat in the same way as we would a confirmed case. And after the 10-day period with no symptoms from onset of symptoms, we would consider them recovered.
Okay, thank you. And as well, the sort of reverse investigation into possible previous exposures with this cluster. You said that it could go back as far as New Year's Eve. Has it actually reached further than that, or are you still in the January range?
No, most people have been. I think there was some around the very end of December, but other than that, it's been all January.
Okay, thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. You mentioned earlier that you hope to have the variant testing abilities here soon. Can you give a more concrete time frame for that?
No, so I don't have a more concrete timeline at this time, but I know that the lab is certainly nearing the final processes that they have to put in place to be able to do that.
Perfect. All right. And I'm curious, what type of equipment had to be brought into the province, or was something we could use already here?
So I honestly don't have the answer to that. You're getting a little bit out of my scope now, Elizabeth. That's really a microbiologist who would have to answer that.
Well, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Dr. Fitzgerald, I'm wondering if you can give some more detail on that COVID case you discussed earlier that resulted in the flight advisories being issued. Did this person have a travel exemption to travel to the province for those 3 days, or what happened there?
So it's my understanding that they did have a travel exemption to come in and do essential work. Okay,
and I know that you mentioned earlier that we're getting the tray of a limited tray of the vaccines later this week, and I know that those delays do play a factor into the vaccination process. But where are we in terms of the vaccinations for the current phase, and how close are we to potentially moving on to the other priority groups?
So right now, we are working through all of those groups in the first phase. We have certainly made good inroads in some of our Indigenous communities, as well as in long-term care and those frontline healthcare workers that we had identified for phase 1. And, we'll be turning our attention as soon as our vaccine supply increases. We'll be turning our attention to people over the age of 85. And then working downwards by age from there. And then phase 2, we're having some discussions about priority groups with regard to phase 2 at this time, and we'll know more in the next couple of weeks, I guess.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, just looking to clarify, you said a shipment's coming later this week from Pfizer, one tray, so are we looking at half of our usual dosage amounts coming on that trip?
So I think we're expecting one tray. I'm not sure what you mean by half our usual dosage, Kellyanne.
Sorry, I thought we usually get 2 trays per shipment, so roughly 1,950 doses.
Okay. So no, so sometimes we get more than 2 trays. It just depends on how much we're getting in, and certainly as time goes on, we'll be getting more than 2 trays a week. But this week it's only 1.
Thank you. And it looks like there's going to be a dance competition in the province in March with 4 people from Alberta coming to set this up. But right now, I guess they believe that they don't have to self-isolate. They didn't have to apply for a travel exemption. I know you can't speak to specific cases, but in looking at this, it seems like that would be an area where a self-isolation would be needed.
Yeah, so anyone who was coming in to do a short-term work contract, if that's what it was, would be expected to self-isolate unless that work was essential work, in which case they would still be expected to isolate outside of their work hours.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Yeah, a question about timing of the releases. I know from talking to people involved that some of the exposures at restaurants were known back on Thursday, and because close contacts were getting tested. Why did public health not issue the advisories until Sunday, asking the general public who may have been there to get tested?
So my understanding is that through the course of the investigation, new information came to light that actually pointed public health in a different direction as to who the initial case, or what we would call the first case of that cluster, would have been. And so that's why initially they didn't feel that that was necessary. And then once that new information came to light, they felt that they needed to do that advisory.
Okay, thanks.
Peter Jackson with the Telegram, do you have a final question?
No, I'm good. Thank you.
Thanks, Peter. Elizabeth Witten with All Newfoundland Labrador, do you have a final question?
No, I'm good.
Thanks, Elizabeth. Richard Duggan with VOCM, do you have a final question?
Yes. I've read about a possible new symptom of COVID-19. They're calling it COVID tongue, and it's involving symptoms within the mouth such as ulcers, rashes, etc. What do you know about this, Dr. Fitzgerald, and is this something that people should be watching for?
So certainly, all the evidence is evolving and ongoing. We haven't had any big discussions about it to determine whether or not it's pathognomonic of COVID. Certainly, many viral infections can give people sores in the mouth and sore tongue and that sort of thing. So it's hard to know, is it just another, symptom of a viral infection versus is it absolutely related to COVID? And I guess that evidence, as it evolves, and we'll evolve if we have to.
Thank you.
Kellyanne Roberts with NTV, do you have a final question?
I do. I'm just looking for what we determine a classification for a cluster, and knowing that these 5 cases are either household or work contacts.
Sorry, Kellyanne, what was the first part of that question?
How do we classify a cluster? Like, what is, I guess, the determining factors?
Yeah, so a cluster is basically a group of connected cases, right? So, and we use it to talk about, as in this case in St. John's, we've had a cluster in Grand Bank and in Harbour Breton. So it's just basically a group of connected cases that can be either people can be traced back as contacts of each other, or they're all connected to an event, for example. So it depends on the actual situation, but sometimes a cluster can be, as in the beginning when we had the funeral home cluster, where it was all linked to one event, or it could be that it's related to some transmission within a small group of people.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks, Leslie. Thanks, everyone, for joining us. And just remember to stay safe and keep your contacts low, and practice all those public health measures that we've been talking about. And guys, please be careful for Super Bowl weekend. I know you all love to party, but you really need to think twice about it this year. Thanks.
Thank you, Dr. Fitzgerald.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.